Have you spent months and maybe even years going from doctor to doctor, from specialist to specialist, and maybe having some blood tests, some scans, some MRIs, only to be told at the end that everything is fine and we cannot find any medical cause for your symptoms? And then you walked out of this appointment feeling even more lost than when you walked in, because you know that there is something is not right. You live with it every single day. I'm Dr. Salma, a former NHS doctor who currently support women with chronic unexplained symptoms. And today I want to explain something that many patients with chronic unexplained symptoms have never been properly told about. There is actually a term for what you are experiencing, and it's called medically unexplained symptoms or medically unexplained physical symptoms. But despite the name, unexplained, it doesn't mean that your symptoms are not real. And it doesn't mean that they are imaginary. And it doesn't mean as well that they are all in your hand. So what does it actually mean? Let's go into it. So what actually are medically unexplained symptoms? They are persistent physical symptoms that cannot be explained by a medical condition. After you've gone through appropriate investigation, that means that if you had the appropriate assessment and examination by your doctor, maybe you had some blood tests or some scans, or whatever your doctor feels is necessary to rule out a treatable condition. This is always the first necessary step. Medically unexplained symptoms are also called persistent physical symptoms. Other terms you might hear: functional somatic symptoms, mind-body symptoms, functional neurological symptoms, neuroplastic symptoms. As you can see, there are many labels, but they all describe the same thing. What you're experiencing is real, and often it's highly disabling physical symptoms. But standard medical tests cannot find structural cause to fully explain what's going on with your body. And structural, it means something physical that has been damaged or broken. For example, it might be tumor, it might be infection. And functional is the system is not working as it should, even though the blood test might look normal. And standard blood tests and scans are excellent to pick up on structural issues most of the time, but they don't always tell us how well the system is functioning. And the way I like to describe it is like when you have a phone. So you've got the phone, which is the hardware. And for example, you've got an app. The app is the software. So the phone and the pieces of the phone, the battery, and whatever is the screen and everything is intact. However, the app is not working properly. So it's only part of it. So the hardware is properly like structure and everything, that we can't find any like, physical thing that we can see with our eyes. However, the app, for example, is not working. So the system is not working properly. So when your doctor said everything looks fine, it just means that we couldn't find the structural cause for whatever you are experiencing with your chronic unexplained symptoms. And that's not the same that there is nothing wrong with you. How common are chronic unexplained symptoms or medically unexplained symptoms? This might be surprising for many people. Around 1 in 4 people visiting a GP in the UK, they have physical symptoms that cannot be explained by a structural cause, which means 25%, and sometimes some data say that it's more than that. So you are not alone. You are simply somewhere where, unfortunately, medicine hasn't fully got up to yet. So what kinds of condition falls under the umbrella of medically unexplained symptoms? So we've got ME/CFS or chronic fatigue syndrome, got fibromyalgia, IBS or irritable bowel syndrome, FND or functional neurological disorder, got chronic pelvic pain, again without any structural cause, got tension headaches, we've got chronic back pain without structural cause, and so many other conditions that fall under this umbrella. And people living with these conditions usually, it depends on what condition, but usually they experience an extreme fatigue. It might be muscle or joint pain. It might be chronic pain over all the body or a specific area in the body. It might be weakness in the legs or the limbs. It might be numbness, dizziness. It might be palpitations or many other physical symptoms. They might experience a very heavy symptoms that they are, as we said, they are real. It's not imagined. It doesn't mean that in medicine we couldn't find a cause, that the patient or the clients, they are imagining it. That's not true. So where does that leave us? If there is one thing that I would like you to retain from this video, is that medically unexplained symptoms, they are not imaginary. They are real, and the suffering of those patients or those people is real. But unfortunately, as a doctor, I can tell you that there is a real gap between the mainstream medicine and between what these people are experiencing. There is a real gap because there isn't much to be offered for people suffering with those conditions and symptoms that we named earlier. And we are still learning how to understand those conditions where the body communication systems are not functioning properly or as they should. So once you had your appropriate medical investigation and every structural issue has been ruled out, maybe the question is no longer what's broken within my body, but we shift to another question. And that was a life-changing for me, living with chronic conditions, unexplained conditions. What is my body trying to communicate? And we did cover that in one of the videos where the symptoms might be the signals rather than something to get rid of. It's the signals, and there is a message there. What is my body trying to communicate? And there is one framework to explain what's going on with those conditions in your body that I really like. And we're going to dig into it. And we named it when we said like the synonyms of medically unexplained symptoms. There is another synonym, which is the neuroplastic symptoms or neuroplastic conditions. And this is what we are going to cover in the next video, to talk more about what's happening in the body, that we can't find a structural issue, but the body is screaming in pain or in fatigue or in any other symptom. And it offers a different way to looking into those chronic unexplained symptoms. And we will unpack that in the next video. Because understanding that concept completely changed the way I view my symptoms and the way I view my chronic conditions, and understanding my own body. And I really hope that it will do the same for you. If this video helps you and resonated with you, I've created a free guide called When Your Tests Are Normal But Your Body Says Otherwise. It's a guide that I really wished I had when I was stuck in the push and crash cycle. It will help you understand what's happening in your body, the energy leaks, where does the energy leak from your body, and that's preventing the healing from happening, and the personality patterns that often keep us stuck in that cycle, the push and crash cycle. And you can find the link below in the description. If this video helped you, please subscribe so you don't miss the upcoming videos. I will see you there.